In today's video, we're going to be talking about how you can learn to squat to a larger depth. Most people have very limited squat depth. So the things you'll find on the internet many times don't actually move the needle forward and improve squat depth. We'll show you today what actually does get you to squat deeper. And as some added proof, we'll show you what a goblet squat of mine looked like merely just 5 years ago when I was following all the gurus who could teach you how to squat deeper with simple banded mobility drills, hip external rotation, hip internal rotation, breathing drills that would help you squat deeper. When in reality, it's so much simpler than that. Now, some people will have you believe that ankle mobility is the cure-all to squats, when in reality, if you look at my squat, my knees actually don't go past my toes. So, ankle mobility really isn't the main factor. Your knees just have to be able to go over top your shoelaces. So yes, the knees go forward, but you don't need to have an obscene amount of ankle range of motion. Many times people will claim that you need to have this ankle mobility to get your knee way out over the toes. And while yes, that can be helpful and important, really all that you need to squat deep is right here. You don't need to get your knee all the way to a wall, as evident by the squat that I just demonstrated. So while this is great, you should probably still be able to do this from an Achilles ankle health standpoint. Not absolutely necessary to get this far to be able to squat deep. Just have to get here. So what is the main ingredient for a deep squat? Well, it's the pelvis. If you watch me, when I get down to the bottom, look how close my belly button is to my thighs. Pay attention to that angle. That angle is super important because that's what we need to improve upon from a flexibility standpoint. And so what you'll notice is that most people who can squat deep, they can get to the ground without ever having to do a bunch of stretches to warm up. Matter of fact, many of them can actually palm the floor. As you can see with me, I can get my knuckles to the floor without having to warm up. I can come in pretty consistently cold and be able to just touch the ground. But again, look at where my belly button is in relationship to my torso. I am compressing this area here. What is that? Well, that's anterior pelvic tilt. Everybody on the internet says the anterior tilt is the devil. Well, here's the problem. Most people actually suck at anterior pelvic tilt. That's why it's an issue. You need to get better at anteriorly tilting your pelvis and do so when it's appropriate. You don't need an anterior pelvic tilt when you're standing upright. There is a little bit of normalcy to that. There is some degree of anterior tilt that is normal. So you shouldn't posterior tilt your pelvis when you're upright. There is some degree of anterior tilt that is normal. You don't need an excessive amount. But if you're trying to touch your toes, you have to go through a large degree of tilting the pelvis forward to be able to get your hands to the ground. And if you can't do that, well, you're gonna be stuck. And here's what it looks like. These individuals right here, they look like a candy cane. Their knees can even hyperextend. They have a lot of hamstring length because their knees are hyperextending. Their torso is running down. They look like a candy cane. They can't bring their belly button down to the ground. You don't need to lock your knees out. Just bring the belly button down to the ground. Keep your shins vertical or slightly backwards. Bring that belly button down to the ground. Don't get stuck looking like a candy cane. Now, this isn't a drill to fix it. This is just to prove a point. So one thing when you do a toe touch is you need to learn how to bring your belly button down. A lot of people, when they do a toe touch, they stay hunched and tucked. Pelvis tucked back, dog tail sticking underneath the legs. You need to learn how to bring your belly button down towards your thighs. So someone who can do this motion well and apply that in a lengthened position, such as a toe touch, that's the person who's going to be able to display an anterior tilt necessary to squat deep. So yes, someone who knows how to twerk probably is a good squatter. There's another medical test, twerking. Go figure. But again, just to show the point, so here's where a lot of people get stuck, right here. Their belly button's sucked up towards the sky. They don't know how to bring their belly button down, reach to the floor with their belly button, still round through the whole entire back. If you want to take that a step further, try it in the seated position. Some people who are great at touching their toes and standing can't worth a darn touch their toes in the seated position. Same concept. Can you bring that belly button forward? Can you anteriorly tilt as you travel forward and touch your toes? Should still see your back rounding, completely normal. Does still lengthen the hamstrings, but the hamstring mobility is not the reason why this is helpful. Your hamstrings cross the knee and it crosses the hip. This will lengthen both the hamstrings from the knee standpoint, and then when you anteriorly tilt, lengthen it from the proximal attachment. So that does stretch the hamstring, but when you squatting, you're flexing at the hip and you're bending at the knee. So because there's a little bit of that anterior tilt, you're lengthening here, but this part is not lengthening whatsoever. It's bending. So you don't need a long hamstring to be able to squat deep. You need a long proximal hamstring to be able to squat deep. Again, an anterior pelvic tilt, have to be able to learn to bring that belly forward to sit yourself tall and then round yourself down. That's what's going to help your squat depth. Now, being able to squat deep, again, requires first and foremost that ability to anterior tilt. If you can do that, the next of most importance, I would say, would be hip internal rotation. Now, the way you go about stretching this is totally different than what the majority of people will tell you. They'll tell you to force the hip into internal rotation. They'll do a bunch of stretches where it just turns the hip this way. Move the hip, move the hip, move the hip, irregardless of what the pelvis is doing. So these stretches really don't do you any good for developing a deeper squat. What does do you good is being able, again, get the hip to go forward over top and get more coverage of the hip socket, which drives the hip socket backwards and creates hip flexion. What is a deep squat? It's hip flexion. It's this angle right here. So in order to achieve that, this has to move. This is what you need to get better at moving, not rotating the leg. What can help to improve some hip internal rotation with this is by crossing midline. So by crossing midline with this leg, you're creating relative hip internal rotation. So if you see this angle, you're essentially creating the same thing by crossing the knee. It creates that hip internal rotation, and then you can move the pelvis. So what that looks like in practice is crossing the back leg behind you. This is the leg I'm biasing into internal rotation with the anterior tilt. As I bring my belly button down, try to touch the toes. Still round your back, still round your head down. But now I'm biasing internal rotation with that anterior pelvic tilt. So I still want to accomplish the same thing. I don't want to just candy cane down. I still need to bring my belly button down with me to touch the floor, then round the back.
3 important tips to squat deep.
Being able to do a standing toe touch, getting the knuckles to the ground, or at least the fingertips to the ground, start there. You could do a seated toe touch, trying to improve that, where you can come in cold, touch the toes. Again, don't candy cane.
And then the third would be that cross-legged toe touch.
One other little tip and secret is if you can't get down very far, if you candy cane it, bend your knees more so that you can tuck the hands underneath your feet and then work from the bottom up. So now I'm going to try to push my hips up towards the sky and gently straighten the knees out. You don't want to jam yourself back there. Gently push the hips towards the sky, but keep the belly button compressed to the thighs, because again, that's the reach that we're trying to teach before the round down. So if we reverse out of that, if you're stuck here, bend the knees, get down here, and then work from the bottom up, keeping that abdomen compressed down to your thigh. That's going to give you a bigger stretch. Another subtlety is when people do that, a lot of times they bias external rotation, so they shove their knees out. That doesn't lengthen the glutes, it contracts the glutes. So keep your knees in towards midline, maybe even think like they're slightly gonna go cross-eyed as you do these, and you'll feel a bigger stretch through the backside. Again, biasing internal rotation. So there you have it. If you can do a toe touch, standing, sitting, and cross legs, you probably can deep squat, especially if you have control of your pelvis, AKA twerk. Now what if you can do that, but you still struggle to squat too deep? Well, number one, maybe you're loading the bar up too heavy and you just don't have the strength to go down any deeper. Number two, we already talked about the ankle. So the ankle does need some flexibility to squat down deep, but you don't have to get that knee way over top of the toe. Third could be that your knees just don't feel comfortable loading into that depth. So you need to have strength through length in your knee. That's beyond the scope of this video. Today we're just talking about flexibility to get down into the deep squat position. And then third is if you can do all that, your knees are capable, your ankles are capable, your hips are flexible, you can anterior tilt, you can toe touch, then it's a center of mass issue, meaning you don't know how to control where your hips go down in space. So when you watch a squat, you'll see some people afraid to load their knees. Again, this speaks to knee capacity. The ability to load your knees forward is important. Some people just load their hips back and they feel like they're always falling backwards. They're trying to deadlift a squat. No bueno. We want to load those knees as you go down and get your butt down low. That's what we want to do. So when you're thinking about controlling your center of mass, some people will also go too far forward and their heels pop up off the ground. They think they have an ankle mobility issue, but really your hips are just too far forward. You need to get your butt back behind the heels so your foot stays flat on the ground. So again, you can see this is a center of mass control. Where's my pelvis relative to my upper body? We want to see the butt behind the knees. Your chest should be facing down at a ground at a 45-degree angle. Easy way to think about this is nose over top of toes. And if you're gonna go deeper, then yes, you're gonna kind of butt wink to get all the way down. That's inevitable for most people. Some people have a ton of flexibility where they can keep flat back here, but not necessary. This is a resting posture. You can rest down here. You can let your back round. So if we're loading though, we're gonna keep the back flat. Butt is behind the heels. Knees are over top of shoelaces. My nose is over top of toes. That's the position, that's the angle. That's the position you wanna be back squatting in. That's what's gonna keep the barbell in line with your midfoot. That's what a deep squat looks like. One final view. As you sit down, the bar stays right in line with the midfoot, and then you power back up. And there you go. There's a squat. Learn those drills to unlock the deep squat, to start unlocking new muscle growth and new athletic abilities. Stay tuned for the next video. Subscribe to the channel if you haven't already. And if you want personal help with your mobility, training programs, injury rehab, email me Greg at sportsrehabexpert.com or sign up at sportsrehabexpert.